Science to Practice. Thank you everyone for joining our webinar today, Science to Practice, Partnering with the Community to Improve Health. Today's webinar is Bethany Center into Policy, which is in community inequities. Just a few housekeeping things before I introduce our panelists. First, this webinar is being recorded. The reason it's being recorded is because we're committed to translating science into practice and policy. So we will be putting this recorded webinar onto our YouTube channel and including captions. Please submit any comments or questions that you want in the chat room. If you are on working for an organization, we want to hear from you. Drop your website or any other information you'd like to in the chat room, and we will be including it in a post-production fact sheet. Also, I will be relaying any questions to the panelists after everyone has spoken. So if you have questions, you can drop them in the chat room while you're thinking of them, or send them at the end of the webinar. Please note that we have been joined by Alex and Brianna, who will be interpreting today's webinar. So please post in gallery view if you need to be seeing Alex and Brianna. At this point, I will turn it over to John Cullen for our land acknowledgement.
Next slide, please. In concert with the blessing of all creations in the Owenton Gari Wategwan, the University of Rochester would like to acknowledge that the land the university resides on is the traditional, ancestral, and unceded lands of the Haudenosaunee. We are grateful to the Haudenosaunee who continue to this very day to be the stewards of this land we all benefit and occupy. This acknowledgement, while important, is just a start and is supported by our university's commitment to listen, learn, and comprehend the Indigenous tragedies of the past while we work together toward building a collective bright future. Thank you.
Thank you for that, John. We are doing this webinar today in partnership with Transform, which is called the Translational Research that Adapts New Science for Maltreatment Prevention. Transform is one of the 3 capstone centers on child abuse and neglect prevention, which is funded by the National Institute for Child Maternal Health. Our Transform Center is a multi-institution collaboration in partnership with other universities and entities working on the same issues. We partner with the Institute of Child Development at the University of Minnesota, and we've partnered with the Education Development Center, which helps us translate our work into everyday language for broad audiences. Today, for this webinar, we are joined by Latoya Young, who is working on an innovative study, which you'll hear more about, called Promise, by Maria Werley, who is the director of Minnow, which is an exciting organization that partners with so many institutions and entities that are touching young parents in the Rochester community and beyond. And John Cullen, who is the associate director of the Subi Center and also has more titles than I can name. I am excited to have this webinar today for a few reasons, and consider doing this a few months ago when I participated in a fundraiser for a crisis nursery, which you'll hear more about later, and met Maria because one of the donors for the fundraiser said, if you have anything left over at the end of this fundraiser, please consider Minnow. And she told me all about it. I reached out to Maria, who got right back to me, and we were able to drop off a carload of goods for Maria, including baby clothing, blankets, formula, bottles, breastfeeding pumps, and the like. So it was a real neighborhood connection. So I'm looking forward to hearing from our speakers. And at this point, I'm going to be passing it over to Latoya. Thanks for being here, everybody.
Hello, everyone. Thank you, Kate. I'm Latoya. I am a community liaison on Project Promise. And I work with families in the community who are pregnant and or have children. Next slide, please. So I'd like to say thank you to the PIs and co-PIs for having an interest in the community. Dr. Sherry Toth and Jody Todd Manley, Dr. Catherine Cerulli, Kate, and Liz Handley and Melissa Sturge-Apple. Thank you all for having an interest in the community and wanting to help families and creating programs that develop early preventive interventions and prevent child abuse and neglect. Next slide, please. So the goal of Promise, we work with pregnant women, and our goal is to promote positive parenting by supporting mothers and their babies. I actually worked on a previous research study, Building Healthy Children, and through that program, I was able to connect with families in the community and do home visits to collect data. And through that work, I developed a passion to serve and support women in the Rochester community. So, hence that's the reason that I'm working on Promise, because, I see that there is a need for supportive services for our pregnant families. And Promise, we're here to evaluate whether having community health workers and additional therapeutic services help improve outcomes for mothers and babies. And what that looks like, giving mothers, a different perspective on things that they've experienced in their life and seeing those weaknesses or challenges that they've experienced through that therapy that helps them to connect and have a stronger bond and relationship with their children and their families. And in turn, that helps family to have a different outlook and to be able to work through challenges that they have experienced. Next slide, please. So like I was just mentioning, some of the challenges that we have learned today is the maternal and infant mortality rates disappropriately impact women and infants of color. Because of this, I have decided to work as a doula on the Black Doula Collaborative with the Healthy Baby Network. And there I provide support services to pregnant women that are going through labor and delivery to help to reduce these numbers of disproportionately impacted women of color. Also, poverty places an extreme stress on mothers and families. And to provide these services helps family to empower them to, want to do more for their families. The other systems, CPS, they're perceiving as having unreasonable expectations. Pandemic further limits access to resources and support. We've all had challenges through the pandemic, and these services through Promises help families with those struggles that we have had. Next slide, please. So some of the successes that Promise has had, families have responded to the supports and the access to free maternal health services and connections to resources. Mothers have reported learning to observe and attend to their infants through these research studies. So they have been able to connect and to learn about their babies and have a deeper connection with their families. Participates in family milestones, seeing babies' first steps. New babies are born by target children at age 15 months. And then fathers are expressing interest in wanting to participate as well. I co-facilitate a community advisory board for the Promise program, and we have past participants participate on that group, and some fathers have participated as well, and they have expressed an interest in wanting to be able to be more involved, not just in their children's lives, but also in the research that we're doing with families, with women and their babies. So it was really great to see fathers really wanting to be a part of that process and not be eliminated, because most of our programs that we have in the community are mainly for women and children. So to see a father or fathers, having an interest and wanting to be a part. One of the young men had mentioned that he took part in a breastfeeding class, and, just to hear, someone being able to, have an interest, but actively take action to participate and want to learn more and be a part of not only his children's lives, but, his family as a whole. Let's see, next, expanding geographic reach with remote options, reducing distance barriers, being able to, have visits done via Zoom has been, a great addition to having and meeting with people in person to do the research visits. So that has definitely been an addition, despite COVID and what all it has brought to us. But being able to reach people that way has been an addition. Next slide, please. And as I just mentioned, some of the adaptations due to COVID, the telehealth we began collecting COVID-19 impact data, how COVID has impacted our families through this. We've the support to concrete needs for struggling families. We've been able to support families that way, the virtual research visits, doing them over Zoom. Also resuming collecting data through in-person visits and digital devices, so through phone, Wi-Fi, computers. It's also, we've been able to recruit our families via social media to help with a decrease in in-person visits. So that has really helped us in getting Promise out there to the community, to the world, to, to our pregnant women so they can participate in Promise. Next slide. So how can I tell the providers and families that I work with about Promise? You can share, our brochures we have shared with Menno. We've dropped off our flyers, brochures to many community agencies. That is the best way to get this program, the word out about this program to families. Share us on social media. I believe there is a way that you can share by going to Mount Hope Family Center's Facebook page, and you can share the link through that page, or you can just share the post. You can call us. Families you can either refer families or they can self-refer. You can give them the information and have them call us. We just ask that you speak with all your families directly and have them connect with us, because we would love to have them participate in Promise and receive some of the supports and receive a lot of the information that we've provided to families. I'm sorry, someone just posted something. Next slide, please. And that concludes my portion of the webinar.
Thank you, LaToya. And I also want to thank you for your work as a doula. It sounds incredibly important, and we were lucky to have you today. I know that you're waiting for a call as we speak, so I'm glad you made it through the first part of the webinar today.
Yes,
and thank you. And now I'm excited to introduce Maria, who's going to share with us what the Need of Others is all about and how they network with community organizations, including this Project Promise. And then we'll be able to ask some questions later how we might be able to further support Minnow. Take it away, Maria.
Hi, and thank you so much for inviting me today. I started Minnow in 2004, 17 years ago, in response to a chance meeting with a mom who had just found out she was having triplets. I had 6 children of my own, one at a time. And my heart just went out to this poor lady, and I was praying about how to help her, and Minnow was the answer to that prayer. I gathered 14 women from my church We collected baby clothes and baby supplies, anything that they might need. We also babysat, did all kinds of things. And we ran around the city delivering things to them. As it grew, it just became impossible to do that anymore. So we made connections with agencies and churches in the area who dealt with families that were in crisis situations, excuse me. So now we partner with 127 agencies and churches, and those agencies deal with all kinds of issues: domestic violence, substance abuse, mental and physical challenges, life-threatening illnesses. It really runs the gamut. So what we do now is we take in donations from the general public and from agencies and churches as well. And we schedule appointments for the case managers to come and pick up those items free of charge for their clients, and they bring them directly to their homes. So they don't have to worry about transportation, babysitting. Everything remains private. It's just blossoming. It's just growing. So in just 2 months' time, I just wanted to let you know. So we served approximately 295 clients through 124 case managers in 55 different agencies and churches. So yeah, it's really growing. We rely on donations. If you want to switch the slide, that would be great. There we go. So yeah, so during COVID, we were even able to keep our doors open. We closed for 2 months, and that was to revamp our policies so that we could be COVID compliant. And we put the items outside the door for the case managers to come. And when they delivered the supplies, they put them outside the door of the family's homes. So there was no contact at all. And we were able to remain open where many agencies and churches had to close during COVID. So yeah, we were able to keep our doors open and keep those supplies coming to parents who really needed them. You want to switch screens, please? Thank you. So we rely on our donors heavily. We take in baby items, personal hygiene products, cleaning products, paper products, feminine hygiene. So we ask the parents, if your children have grown out of certain size diaper, we ask for the partial packs of diapers rather than throwing them out. If they finished a can of milk, they're onto whole milk now, and they have cans of formula that are still in date and sealed. We will take those items. We try to recycle many things like that. So rather than throwing things out, there's so many people that need those items, and we try to get them into the hands of people who need them most. So yeah, if you would like to look on our website, we are a ministry of Project Urge. We've been with them since 2006, and they are a nonprofit that brings urban and suburban churches and organizations together to work on behalf of the poor in the city. So it was great. We've been able to make many contacts through them, and we're just one family. So yeah, look on their website, and we have a page on there. We also have a page on Facebook, Mothers in Need of Others. So yeah, that's it.
Thank you so much for that information. And I am sure people are going to have questions for you as we move to the chat later after John has presented. Before I hand it over to John, just a reminder to be putting in information in the chat about your organization, who you are. We're glad you're here, and we'll be talking more with all of you once John presents. John, thank you for being here.
Thanks, Kate. Thank you, everyone. If you could just actually go back one slide, that would be great. Just to give folks a little bit of an overview of our Clinical Translational Science Institute. So we've been established at the University of Rochester Medical Center since 2006. And really our goal is to help research teams collaborate and produce faster results. And I'm going to share some information about resources that are available to community partner and researcher teams here at the Clinical Translational Science Institute. For those of you who aren't in the Rochester area, please note that there are an additional 60 similar institutes across the United States that are funded by the National Institutes for Health, National Center for Advancing Clinical and Translational Science. So there may be similar resources near and available to you. So next slide, please. So I'm going to talk about our community engagement function. We have multiple functions within the CTSI to help research teams, but one of the most important ones that has been, I think, sort of community facing is our community engagement function. And our philosophy as we do our work is that the community members are the experts in their communities. So we're actually doing with the community as researchers, not for or to. And next slide, please. So I'm really going to share information on a lot of the resources that are available to teams. These can be just to U of R researchers or to researchers and community partners who may not even have established a partnership with U of R researchers just yet. And they can be in relation to education, access to community experts, and networking so that we can identify research priorities. Next slide, please. So one of our most successful programs over the past 4 years has been our community-based participatory research training program. And for those of you who aren't that familiar with CBPR, that's really a form of research that involves community partners right from the very start. So from the design and the community partners identifying what the needs are in the community, right through to collecting an analysis of results and dissemination of results. And the goal of this program for us has been to create community academic research partners where community members are co-researchers. So many of these individuals, be it the community members, have not participated in research before as researchers, and many of our U of R researchers have not collaborated with the community before. Next slide. So there's two parts to the program. We have the Introduction to CBPR course, and that actually runs from September to March. So it is a big commitment for folks, but that allows us for community partners and U of R researchers to form relationships. And they meet once a week from 5:30 to 7 p.m. Pre-COVID, we met in person and we had dinner together, but unfortunately, we're now doing all of this online. This course is open and free to any community member and also to our U of R researchers. And our hope is that the community will create collaborations with our U of R researchers who are part of the cohort, and they will make use of the opportunity to apply for a pipeline pilot funding. Next slide, please. And I'll just say that over the past 4 years, we have had about 76 folks enrolled. We currently, in this year's cohort, we have 18 people enrolled, and that includes community partners and researchers. And so the ultimate goal is that individuals will apply for our CBPR Pipeline to Pilot Awards, and we fund 2 15,000 awards per year. And these are, the starting point for teams so that they can apply for larger funds at a later date. And awards last year included research into mental health treatment for kids in urban communities, the impact of loneliness and chronic medical conditions in minority communities, and faith-based interventions to reduce obesity in African Americans. We actually had 3 great applications in 2019 that we managed to find the money to fund all 3. We have seen historically that those awards have resulted in new additional funding for community partner researcher teams and also publications. Actually, was just looking today, one of our first pilots that we awarded was with someone from our dental school and someone from the Healthy Baby Network with Sharita Bullock. They were both co-investigators. and they looked at prenatal oral health program, and that actually did lead to additional funding. Next slide, please. Another course that we recently developed that's available to both community partners and researchers from the U of R is their Structural Racism in Healthcare and Research course. And I forgot to point out that for our CBPR program that I mentioned, it was co-developed and is co-taught by community partners and U of R researchers. We took a slightly different approach with this Structural Racism in Healthcare and Research course. And this actually was developed and delivered by community partners only. So the community partners, again, being the expert in this. And this was a 5-week course to explore how a history of racism has shaped the relationship between doctors and researchers with patients and research participants or BIPOC. And we left this open to all U of R researchers and community members. We had over 100 people express interest in participating. Our numbers were limited to 24 just to keep it a nice size. So if we get up the next slide, please. So we recently wrapped this up last month, but you can see here an overview of the classes. We had 5 classes, and in addition, because a lot of the content could actually be quite traumatic and for folks to listen to or to become aware of, we actually had some meditation, breath work, and movement included in these classes. And we used a cohort model. So really folks working together to create a courageous space for sharing and growing together. Feedback from the course was great. We're just trying now to figure a way to launch it again next year and to make it something that's sustainable. Next slide. We have a University of Rochester Medical Center Community Advisory Council that we help convene, and that's representatives from 20 community organizations and leaders, and also leadership from the medical center. Those community organizations include, Common Ground Health. We have government, we have education representation as well. And they meet quarterly and really guide and support our education, research, and patient care. They will inform research projects. They additionally will inform, for example, if we're thinking of having some new healthcare facilities in the city, where should those go, what are needed. So they've been instrumental in providing feedback to not just our clinical enterprise, but our research enterprise. Recently, maybe not too recently, but we had a group who was doing an exemption from informed consent study, where people would not be able to give consent, and should this study move forward and provide a valuable feedback. That's co-chaired by Wade Norwood and Scott Benjamin. And we'll send a link. I think Kirsten did put a link in the chat for the CTSI website. So a lot of this information is listed on there. Next slide. Another novel initiative we offer to researchers and research teams are community engagement studios. And again, these pictures were taken, I should put a disclaimer on there, they were taken pre-COVID. And this is a structured 2-hour dialogue that actually engages patients and community members as experts, and they provide feedback on biomedical and clinical research from a community perspective. We have actually reduced these down to 90 minutes and are on a virtual platform right now, and community members are compensated for their time for providing the feedback. It may be general feedback, or it may be in relation to a specific research project. So for example, we may have someone who's doing research into neuromuscular disorders. So we will have folks who can speak to that, or if we just have a general recruitment question, we will just have community experts with not a specific background. Next slide. You can see here some of the benefits for our research teams. They have found through taking part in these community engagement studios, increase understanding to the community, reflect on the impact of research with regard to real world setting and our community priorities. It also actually helps with building relationships with community partners. Good example, we did one of these with Dr. Angela Branch, who was coordinating COVID vaccine study. And that really was her first foray into sort of the community world. And out of that, she did develop many community partners. It allows for immediate feedback, and it allows for increased participation of hard to reach populations. Next slide. Not going to go into these too much, but you can see we have had researchers from a variety of different departments who have asked for a studio to get feedback, and it could be around, quite often we get recruitment assistance, development of messaging, and consent forms. So again, right across the spectrum of a research study, we can have our community members give feedback. We do offer, if the researcher doesn't have a lot of resources, this can be offered or free of charge through the CTSI. But we also now have researchers actually including them in the grant application. So there is resources available for compensating community members. Next slide. This really is specifically for our researchers, not so much for our community members, but we have a population health coordinating committee that meets every other month. And I know some folks who are actually on the call right now are part of this committee. And it was created in 2006 and came up with our mini grant program, the SBAC Community Health Improvement Awards, and also really allows for URMC faculty, staff, and trainees with strong interest in promoting community health improvement efforts to coordinate and to network with each other. And we have allowed folks to share resources, challenges, and research trajectories. And also we have used it as a platform to brainstorm and connect with researchers across the university if individuals are looking for collaborators or want feedback on projects. Next slide. I did mention our grants or our CBPR grants earlier on. Our community health mini grants are smaller. They're awarded quarterly and they are $2,000. And they will cover research and health services project and really support partnerships between the university and community. Now, I just mentioned 2 grants specific to community engagement and community-based participatory research here. I want to make folks aware that we have a lot more grants and pilot funding available through the CTSI. It's just not specifically focused on community health, but you can submit community health related grants for these other types of funding, and you will see those on the CTSI funding website. Next slide. Finally, we also offer consultations. We have our community engagement consultations that we offer in collaboration with the Community Center for Community Health and Prevention. And this helps to ensure that researchers have the support they need to conduct and develop health research studies in the community. And in addition, we have our promoting diverse representation and research function that really provides consultations in recruiting diverse populations into research studies and based on race, ethnicity, but other populations that we are interested in, but that are considered special populations by the NIH are children, older adults, adult survivors of formerly lethal childhood diseases, and rural populations. I think that was my last slide. Let's see. Okay, so we will be we can send these out to the group, but you can see my contact information, and Laura Sugarwala, who co-leads this function with me, who's the Director for Community Health Partnerships with the Center for Community Health. I would be more than happy to talk to you, and we can send out a link to all of these resources. Thank you.
Thank you so much, John, for presenting such a comprehensive view of what your center does and how people can engage and offer their expertise. Prior to moving into the Q&A, I'd like to share 2 more resources that the University of Rochester also have. The first is launching on January 1. It is funded by the New York State Office for Mental Health, and we are several of the sites statewide. What Project Teach will be doing is offering consultations to OB-GYN providers. You'll be able to speak directly to psychiatrists with perinatal mental health experience. Also, linkages and referrals to community-based organizations such as those that are even on this call, and resources for perinatal individuals. You can see here the information for contact is Project Teach, and also the phone number. This will be reduced to our fact sheet as well that Kirsten mentioned in the chat earlier. Also, those of you working with smaller organizations or at the University of Rochester, we know that this work can be very challenging, both from the research side to the clinician side, and working with populations that are struggling to have their social determinant of health needs met can cause strain on the providers as well. So if you are a U of R employee, there is a behavioral health program that is free to you. If you are an outside organization, you may be one of the employee assistance program partners with the University of Rochester. So you can learn more about that too, because we know it's important for people to be keeping themselves well and healthy so we can continue to provide services to those that need us, and we can continue to learn from our community what they need from us. Lastly, just two brief resources for this particular perinatal population are the crisis nurseries. The first crisis nursery is located not far from the University of Rochester on Genesee Park Boulevard. The second is located not far from East High at Rosewood Terrace. The first one is called the Crisis Nursery of Greater Rochester, and Owen's House is the second one that was started in 2018 in May. These centers, excuse me, one can drop off a child 24/7 to have care if they're having parenting difficulties, either as a result of mental health, physical health, grieving, dealing with domestic violence, house seeking, job seeking. These are a really important resource for families that are seeking to get back on their feet after they have had a struggle or a challenge. The services are free, and you can locate those services by calling the Center for Youth. And now I am going to open it up for questions, and I'd like to start with a question for John in about these studios, about Toya work, the renewal for a center grant. Is it possible to link and have a studio conducted by the CTSI to help transform here from the community about child abuse and neglect prevention? You said sometimes it's about a special population.
So Kate, sorry, you kind of broke up a little bit at the start. I heard the second half of the question. I didn't hear the start. I apologize.
Oh, I'm sorry. John let me know my internet was a little unstable. I'm not sure what's happening there. John, the Transform is housed, as I said earlier, at Mount Hope, and they are getting ready to submit a renewal for a grant. Is it possible that the CTSI would host a studio with people who work with children who are abused and neglected and be able to ask the community what they need? And Latoya and Maria, please feel free to come back on because I'll be addressing questions to you as well.
Yeah, Kate, that's a great question. That's something we'd be more than happy to do, just to, to help folks get the community perspective. And again, not just as you rewrite the grant, but also thinking about including this as a resource in the grant for, collecting information and improving on research, on your research studies. But that definitely is something we would consider doing.
That's wonderful. And a quick question to Latoya. Latoya, how is it that somebody can get information about having a doula?
You can log on to Healthy Baby Network website. There is contact information. The doula coordinator of that program is Paula Nesbeth, and I can actually post that in the chat as well, the website and the phone number where people can contact her if they're interested in a doula.
That would be wonderful. Thank you, Latoya. Maria, you indicated what the needs were in terms of donations and how people can get their donations to you. Can you tell me a little bit about how your organization uses volunteers? And potentially we might have some individuals on this call who might be students or graduate students or staff at an organization that would like a volunteer opportunity.
Sure. So we're there Monday, Wednesday, and Friday from 11 to 4. Most of our volunteers sign on for 1 or 2 days a week from 10 to 12. Those are the busiest times when we make up bags and take in supplies to hand out to the case managers. So yeah, if somebody can only do afternoons, we can certainly accommodate them there as well. But like I said, the majority of the time is between 10 and 12. And that's where getting things ready and case managers are coming. Usually our busiest times for them to pick up is between like 12 and 2. So we get things ready and take them upstairs to put them right at the door for everybody to just take them and go on to their way to deliver to their clients.
That's wonderful. Thank you.
Mm-hmm.
Latoya, if somebody were to reach out to you to become involved in the Promise Project and was eligible for the study, how long does someone stay in the study with you?
Participants stay through pregnancy till the baby is about 12 months, up to 15 months, I'm sorry. So it's through pregnancy when they're enrolled through 15 months, age 15 months, a baby.
So 15 months is a long time to establish relationships and learn about new services. So that's wonderful that people can engage for so long. John, can you tell us what, if any, programs you're currently running or studios you've done that focus on maternal child health? Has that come up as a topic yet?
Oh, I think we maybe had one maybe 3 or 4 years ago, Kate, and I think it was around this prenatal health, around dental caries. So that was something that was a collaboration between Xinjiao and Sharita. But we're open to any. We just pre-COVID, we were actually planning one with pregnant women. But unfortunately, COVID hit and we sort of had to pivot where we were focusing our energy and our time. And a lot of that was around COVID-19. We've done, as I said, with Dr. Branch, we did some on the COVID-19 vaccination or vaccine trials. We also did some on the at-home test kits. We helped some of the researchers with that. The one other thing I will say about the community engagement studios that has been fantastic, and maybe with younger kids, I can speak to a little bit about one we did with with one of our medicine residents, but it really has allowed us and researchers to foster long-term relationships. So we had a resident who was interested. I don't know if anyone's heard of the Dolly Parton Imagination Library. I'd never heard of it, but it's a program that Dolly Parton started around providing books to kids once a month from they're born until they're 5 years old, free of charge, and encouraging their guardians and caregivers to read with them. So we had one of our PEAS residents who was really interested in starting this in, and I can't remember the zip code now, but it's the most impoverished zip code in our city. But we were able to connect with Sister Marcia Allen from Vineyard Farms, who's done some great work with the community. And we were able to host a community engagement studio at Vineyard Farms. We did it was in, I think, May, but in a gazebo. So we were semi-outdoors, but we were able to have local participants give feedback on whether they would be interested in participating in this Dolly Parton Imagination Library in this zip code. And, they provided invaluable feedback. Matt Present, who was the resident, has now a lasting relationship with Sister Marcia. He's gone out, he's helped with vaccination at the Vineyard Farms, but also he's enrolled 100 kids in this zip code in this program who are now getting books. So the sort of the ripple effect of these studios, it goes beyond just what they find out in the moment. It's the relationships as well. I'll stop
I'm going to
talking.
put a pin in that for Transform to consider a studio with you. That sounds very exciting. This is a question for LaToya, Maria, and John, and I'll take you in that order if you would. I want to share just a small story with you, and this is a true story. A young woman showed up at our church on Good Friday, and she had a child that she was holding in her arms. She had no stroller, she had no formula, and we ended up connecting her. She had safe housing for that evening, and we ended up connecting her to the crisis nursery by Strong. And when I went over the next morning to take her, I was not surprised, but I was saddened that where she was staying, and she was familiar with the neighborhood, was actually within a stone's throw of the nursery. She had lived in that area for a while, and the house was co-located in the neighborhood. We have an overwhelming amount of agencies and resources in our community, as evidenced by what all of you have spoken about. Mount Hope offers more programs than just Promise, and Maria has spoken to the number of organizations that she works with. My question to the three of you is, how do we challenge ourselves to get the word out to the individuals who need us? What do you all think is the best way to message people who are in need of the resources that we have?
I think just getting out in the community. I think through people who have previously participated in research studies or any program, community agencies. I think, the word of mouth through participants is the best way, because they can tell the story of, their experience and the services that they have received. Also, I think through medical appointments, I think, our doctors should have information that they can give out to families who are in need of these services, and, connect them to those services.
Thank you. Maria, what are your thoughts? How do you get the word out to the population you want to serve?
Well, because we're an emergency assistance program, we work through care managers, but I'm thinking that the first point of contact should probably be the doctors, the OBs and the pediatricians. They come in contact with families daily, and they should be able to plug them into programs, and we from there work with the case managers in meeting the needs of the specific families. One thing that Minnow has kind of grown into now is being a resource and referral program as well. Obviously, no program can cover all their bases for all the needs for every person. So we hand out brochures and flyers and business cards through our bags that we distribute directly to the families. So whatever their issues may be, they can find things in those bags, that resources that they can use, access in the community. So, and it's been working out very, very well. I have families call me all the time looking for furniture and things like that. We don't do that anymore, but we can plug them into services that do offer things like that. So yeah, it's been working out.
So I think LaToya and Maria both hit the nail on the head with that one, Kate, and it's something that you and I have been working on for years in our research projects. And, we're not just collecting research data, we're sort of connecting people with resources to address their needs. And I think as a healthcare system, we're starting to do that. So here at the medical center, we are starting to collect information on social determinants of health. So it's not just, why are you here, today, what's the purpose of your visit, but looking at other social determinants such as food insecurity, housing insecurity, other needs, and then connecting with the resources. And I think we have such great resources in our community, but we do not do a good job of promoting them. And I'm still trying to figure out why that is. But I mean, I think, for example, of our crisis nursery should, our social work team, do they know about it? Should we be sending repeated messages so people sort of get it into their brain that it is a resource in the community? But I think we definitely could do a better job around messaging. But I think as a healthcare system, at least in our hospitals, where we tend to see those that have more needs than we do in our primary care practices, that we are beginning to make those connections.
Thank you, everybody. I'm going to jump to Latoya for just a moment. Latoya, I'm curious how you see your work as a doula and your work at Mount Hope being complementary.
My work as a doula, supporting women through birth, labor, delivery, providing childbirth education to families, meeting with them postpartum, and being a community liaison, research assistant at Mount Hope, just connecting with them, providing support to families who need it, and resources to families who are not familiar with what's out in the community that can help them. Yeah.
Thank you for that. There was another program that has been put into the chat, Baby Love. There are certain pregnant and early parenting individuals you might be working with that might be eligible for Baby Love, which you can reach through the University of Rochester as well. And we will be sure to include that information in our chat fact sheet, which will come to all of you who are in attendance. We are getting close to the time when we will be wrapping up. So I will just be, first of all, thanking Kirsten and Catherine and John, who are part of the planning team. I'd like to thank our speakers tonight who came on with us and took time out of their busy schedules. I'd like to thank all of you who participated. There is an evaluation that will follow this webinar. It is wonderful if you can give us your insights, what other topics you want to hear about, if you have any other speakers that you would like to hear from, that we can facilitate bringing them. We do love it if you recommend a community provider along with another speaker. We like to have voices from the community as well as the university or the science side of the fence. So we invite you to make recommendations to us for that purpose. John, if you can just speak for a moment how they will hear about their evaluation link, and then you will be eligible, if you want, for a raffle if you participate in our evaluation for a $20 gift card.
Sure. Thank you, Kate, for facilitating this. At the end of the Zoom webinar, when you log on or when you sign off, you should get a link for the evaluation. We will also be sending it out tomorrow or be automatically sent out via email. There is a survey. You can just answer the questions in it. You do not have to provide your email address, but if you want to be entered for the into the drawing for the $20 Amazon gift card, we ask that you include your email address so we can follow up with you and contact you. And as Kate said, we value your feedback, our suggestions. That's what really drives a lot of the programming we do at the center. And we really want to identify what the community wants to hear. So please do take a few minutes to give us some feedback.
Thank you very much. And at this point, I will close the webinar. I hope everyone has a wonderful evening. Thank you, Maria, Latoya, and John for being here, and for the people who helped in the background, Katie, Hannah, and Jody. Thanks, everyone.
Thank you.
Thank you.